I request Dr. Adapa Karthik IAS Special Secretary, Department of Health and Family Welfare, Government of Punjab, to share his thoughts on enabling healthcare with technology. Over to you, sir. A huge round of applause for him, please.
Dignitaries on the dais, ladies and gentlemen, thank you for having me here. Before I basically talk you through the landscape in emerging technologies around the world, I want to give you a brief introduction about myself so that you understand where I'm sandwiched. I'm an IAS officer from the Punjab cadre, but I'm also a medical doctor trained in India. And then I did my master's in public health in the US and also did a PhD in health informatics in the US. I'm a practitioner, researcher, and an educator. I'm a faculty at Yale School of Medicine and at University of North Carolina School of Data Science. So I'm essentially a medical practitioner with training and research in data science, especially in artificial intelligence and machine learning. So most of my research is, of course, based in the US at the cutting edge in oncology informatics. That's where I specialize. I also work for the government of Punjab, so I will also talk about some of the interesting initiatives and innovations that we've had in the government of Punjab. Let me first take you where globally, in terms of emerging technologies, the world is moving, and then I'll talk about what is happening within India as well. Essentially, what is happening in the AI and machine learning space around the world is, especially in the first world developed countries, there's a lot of access to data, both not just structured data, unstructured and semi-structured data. So what essentially is happening is most of the AI machine learning applications that are built are not just on unimodal data, but on multimodal data. So essentially, machines do well in terms of their intelligence when they have all forms of data. And that is essentially where AI and machine learning are going to go. The next part is now with ChatGPT and other large language models coming in, you can actually dig into these large data sets around the world, you can scrape them. And so no longer are going to be times where people are just going to Google things, but people are going to chat with AI chatbots. Now, what this basically emerges is an interesting dimension where AI machine learning is, over the next decade or so, is going to become already an integral part of our life. It is already an integral part of our lives now, but it's going to be even more embedded into our lives. Now, what are the challenges because of that? The first challenge that emerges because of this AI machine learning coming into the world is on safety and the risk associated with AI and machine learning. Essentially, when we have AI and machine learning, it is almost like a drug that we take. So when we take a drug, it's not that we would take the drug without it going through a phase development. So there are safety checks. So you have animal trials and you have clinical trials for safety, and then you have for efficacy as well. Essentially, around the world, the movement is towards having these AI and machine learning applications focused on safety and associated with risk, responsibility, fairness, and others. So essentially, both in the US as well as in Europe, there are large-scale regulatory reforms that those countries are thinking about. And that is a big space where we really don't have anything in India. Now, does that mean that we don't do anything about AI and machine learning? Not at all. So one interesting initiative, innovation that we have in Punjab, and this is by far the first application in the entire world where there is an AI machine learning application that's not just been, so most AI and machine learning applications, especially in healthcare, are largely in the clinical space. They've really not got down to people. But one intervention which came from a startup from Bangalore called Niramai, what they've essentially done is they've come up with breast thermography. So essentially, when we diagnose breast cancer, the standard modality is mammography. Now, mammography is again a intervention from the first world. So essentially, you take the breast tissue and take almost like a photocopy of the breast tissue. And what happens because of that is you have to derobe yourself, you have to allow a technician to hold you, and it's a very painful and an excruciating feature. So what essentially has happened because of Niramai's breast thermography is we now have a thermal scanner. So the patient goes into a closed room and the patient sits before the thermal scanner, and you simply take an image of the thermal scanner, and there is nobody around there. The technician sits outside, and one did not know whether this technology, which is also augmented by AI, once you have a heat map of the breast tissue in 5 different regions, it's not just you're taking anterior, posterior, but you're also taking lateral sides. and all the sites. And essentially what you're looking into is the thermography. So it's basically what is the heat that is being generated both by the normal and the abnormal cells of the breast tissue. And then you convert that with deep learning algorithms and ensemble algorithms. You convert this heat map into a BIRAT score, which is essentially what you would have in a mammogram. Now, we've done multiple studies in both Government of Karnataka and Government of Punjab have helped Nirmai take this tool from a proof of concept to a real-world, large-scale population-level screening tool. I'm happy to report to you that in the Government of Punjab, we've been able to screen about 20,000 women using the thermography equipment augmented by AI. Now, this is the first ever example in the entire world where you have a large-scale AI-enabled screening tool to basically detect for abnormalities in breast. It's not just about breast, no other organ. You have these AI-enabled tools at the population level. Whatever AI-enabled tools you have for screening, you have them for lung, you have them for a variety of other tissues as well, other organs as well, but they're largely at clinical trials, but you don't have them at a population level. Now, how did this innovation happen? This innovation happened primarily because we have such a possibility and such an ecosystem within India where you have startups coming up with very interesting ideas, and then you have governments accepting these innovations and helping the rollout of such large-scale projects. Now, essentially, it doesn't mean that this AI application is not vested with its own challenges. Now, the basic challenge first is from the users themselves. The biggest challenge is women, would they be comfortable? Now, what we've realized is once we've had about the first 2,000, 3,000 women coming comfortably to the camps, then this became almost like a spree in rural Punjab, in the hinterland, where people realize that this is a fairly easy tool. In about 20 minutes, you get screened. So essentially, what you want to do is when you design technology, you want to think about the end user. So what you call as human-centered design thinking, or you want to talk about participatory co-design processes. The second part is how do we therefore get this technology? So a lot of startups come up with very interesting ideas, but what Nirma has done really well is it has also embedded science into it. So it is not just that they've gone about coming into the commercializing this product. There's a lot of scientific patents. For example, we've helped them get about 10 patents just from the US FDA. They have about 30 patents from the Indian government side. They also have patents from Europe. They have patents in Australia and Singapore. So what we've essentially seen is we've seen science powering this innovation. And then when the startup technology, science, and the government come together, here is an example that is truly outstanding, not just to India, but around the world. Now, I also want to talk to you about what are some use cases and emerging technology beyond AI and machine learning. One major challenge that India is likely to face in the next 10 years is we're coming up with a large number of medical schools in India. When I went to medical school, we've probably had about 200, 300 medical schools in the state, in the center, and the private sector. But now, both in the private sector and in the public sector, there are a large number of medical colleges that are coming in. Now, one challenge that we are not able to really think through is when we have these large medical colleges coming in, which is more the brick and mortar, you set up these medical colleges, how are we going to train our young medical professionals? Now, the problem is you won't have so many trained medical teachers, and you would essentially find your students not having adequate training, so we're not going to generate great quality medical doctors. Now, there's already a thinking in states like Uttar Pradesh, states like Punjab, or even also in the government of India, on how do we therefore come up with this challenge where you don't have trained medical professionals, educators who would train the next generation of medical students. So how do we face this challenge? So essentially, when you look into what has happened in the first world countries, they've built what are called simulated labs. So essentially using VR and AR, or for that matter, mixed reality, what you can do is you can have these simulatory labs where essentially all the medical skills that a student needs to learn, you can break the skill into various subset of skills, and the student can learn the basic skills on these high fidelity mannequins in a simulated environment. So it's almost like this. So if you want the student to learn how to suture, you go to the simulated environment, use a high fidelity mannequin, break the skill into subset of skills, and you first learn the skill on the high fidelity mannequin before you actually experiment on the real patient. So essentially, therefore, in all the medical schools in the US, for instance, it is very mandatory for students to pass their exams on skills on these virtual simulated labs. So every department in the US would have these simulated labs, which are essentially augmented by either AR, VR, or mixed reality, sometimes even more advanced technology. And then you break the skill into sub-skills. Students learn the skills on these high-fidelity mannequins, improve their skills, and only then start working on patients. Now, this is something which has been tried, tested. There is enough evidence on how this simulated learning helps medical students. Now, can we really adopt that in India? But some of these simulated labs, the problem is they're extremely expensive. Now, one of my own labs in the US, for instance, we've spent about $5 to $6 million just to build one simulatory lab in the field that I specialize, that is radiation oncology. Now, a lot of medical colleges in India are not going to have that many resources. So essentially, as a country, we need to think about how can we build these low-cost, high-fidelity mannequins and virtual simulated labs so that the next generation of medical students can actually learn in a virtual simulated environment rather than actually trying on the patients without actually testing their skills. So there's a lot of initial work that is happening. We are looking at building these low-cost prototypes. There's a lot of labs based in Pune and in Lucknow and in Chandigarh, where we're coming up with also partnering with IIT Mumbai, IIT Ropar, IIT Delhi to come up with these low-cost, high-fidelity mannequins and virtual simulatory labs. So I wanted to kind of give you examples that the world has become such a connected place. There's a lot of interesting technology that is growing out in research in healthcare in the West. There are also very interesting examples of great innovations happening within India as well. So I want to just leave you with these two broad thoughts. And thank you so much for your attention. Thank you.
Thank you so much, Dr. Karthik from the Government of Punjab. That's unique what you have said, that thermography powered by AI, perhaps for the first time in the world it's happening. And also how you are focusing on the low-cost prototypes by partnering with the Center of Excellences. That is important for a country like India. And again, I think here also partnership, collaboration will be the key. And it also talks about the innovation in the policy and also approach to the healthcare. That is also needed. I think that has started happening of late in a country like India as well. Thank you so much.